Moving on to coronavirus now, as the FDA considers approving the first COVID vaccines for emergency use, health officials are debating who will be the first to receive the potentially life-saving medicine. A Department of Health Services subcommittee met again this morning, working to finalize recommendations for the DHS to allocate vaccine to different entities statewide once doses become available. Our Ryan Jenkins reports.
After a meeting early this morning, the State Disaster Medical Advisory Committee's Vaccine Subcommittee now hopes to vote on Friday to send forth a list of recommendations related to allocating vaccines to different entities throughout the state. And those recommendations will then be opened up for public comment. This subcommittee is charged with recommending how the Department of Health Services will allocate the early limited doses of a COVID-19 vaccine once one is ready to go. Their goal to be ethical and equitable.
We want to have at least your discussion ready to go by the time vaccine becomes available.
The team actively considering 6 recommendations, which are still being discussed and fine-tuned. They include giving equal priority to healthcare providers and long-term care facility residents, giving greater priority to vaccinating entities who will administer vaccines in communities characterized by higher levels of social vulnerability, and incentivizing places that will vaccinate people unaffiliated with specific healthcare providers, such as first responders. The members of the subcommittee agreeing on some, but not all of these recommendations, as they now plan to vote to send a final draft of recommendations forward to the State Department of Health Services later this week, which will then be opened up for public comment. Now, this subcommittee will not be coordinating the deployment of vaccines. A different part of DHS will handle that. There's a lot of different minds coming together to make sure that Wisconsin is ready once a vaccine is. Reporting in Milwaukee, Ryan Jenkins, TMJ4 News.